Okay, let's get started. Overactive bladder overview. What is overactive bladder, or OAB? Well, it's defined as the presence of urinary urgency, usually accompanied by urinary frequency and getting up at night to urinate, which is called nocturia. And it may be associated with urgent incontinence, which is basically leaking urine on the way to the bathroom, where you feel like you really got to go and you can't hold it and you start to leak. So that's urgent incontinence. How common is it? 33 million Americans have overactive bladder. Almost 1/3 of all women have overactive bladder and 16% of men. So it's very common. You're definitely not alone. What are the risk factors for it? Well, as you get older, you're more likely to have overactive bladder, so age is a risk factor. Obesity can cause OAB. And if you think about it, with more abdominal pressure pushing down on the bladder, that tends to be irritating and can cause those symptoms. Women are more likely to have OAB, but it is also common in men. So gender is also a risk factor. Who gets treatment? Well, it is definitely a negative on quality of life for a lot of people. It can lead to depression, isolation, loss of job productivity, trouble with marriage. And so it can be a real negative quality of life issue for many people. So if you're noticing that it's affecting the things that you do, you don't want to go out because you're worried about leaking, then definitely that's one example of somebody that should have treatment done. So it depends on how much it bothers you. So how do you improve your symptoms of overactive bladder? There's national guidelines that have been put out that address the treatment of overactive bladder. And these guidelines suggest starting with behavior modification, and there's a module listed below that goes over what that entails. For those patients that aren't satisfied with that alone, they may require medication for overactive bladder. Others may need advanced testing and advanced treatments to help with their symptoms. And basically, the goal is to get you to an endpoint that you're satisfied with the way that you're urinating. It's important at this point for you to really set a realistic expectation as well. So let's say you want to improve your symptoms 50%, and that's a realistic expectation. So you set out to reach that goal, and the purpose of this program is to help you get to that point. So we're going to give you education on each step. We're also going to be assessing you along the way so that you can see the type of progress that you're making. The more you put into this program, the better your outcomes are going to be. So let's get started.